Question 1. A 65-year-old male patient with a history of heart failure, NYHA Class 3, is prescribed furosemide 40 mg once daily. Which of the following parameters should the pharmacist counsel the patient to monitor regularly and report if abnormal? A. Blood glucose levels. B. Serum potassium levels. C. Thyroid stimulating hormone, TSH. D. Liver function tests, LFTs. Answer: B. Serum potassium levels. This question tests knowledge of loop diuretic side effects and patient monitoring, specifically for furosemide in a heart failure patient. Furosemide, a loop diuretic, works by increasing the excretion of sodium, chloride, and water, but it also significantly increases potassium excretion, leading to hypokalemia. Patients on furosemide should regularly monitor their serum potassium levels to prevent cardiac arrhythmias and muscle weakness, and they may need potassium supplementation or dietary adjustments. For example, a patient might be advised to consume potassium-rich foods like bananas or oranges, or take a prescribed potassium chloride supplement. Always remember that loop diuretics are potassium wasting, making potassium monitoring crucial for patient safety. Question 2. A pharmacist receives a prescription for amoxicillin 250 mg per 5 ml, 125 ml. The patient is a 5-year-old child weighing 40 pounds, and the prescribed dose is 250 mg 3 times daily for 10 days. What is the total volume, in ml, that should be dispensed? A. 100 ml. B. 125 ml. C. 150 ml. D. 200 ml. Answer: C. 150 ml. This calculation question requires determining the total volume of medication needed for a full course of therapy. The patient needs 250 mg per dose, 3 times daily, TID, for 10 days. This means a total daily dose of 250 mg *3 is equal to 750 mg, and over 10 days, a total of 750 mg per day *10 days equals 7,500 mg of amoxicillin. Since the concentration is 250 mg per 5 ml, the total volume needed is 7,500 mg/250 mg, *5 ml equals 30 by 5 ml equals 150 ml. It's crucial to calculate the total amount required for the entire treatment duration, not just the dispensed bottle size, to ensure the patient has enough medication. Always confirm that the dispensed quantity is sufficient for the full prescribed course. Question 3. Which of the following federal laws establish 2 classes of drugs, prescription and over-the-counter, OTC? A. Poison Prevention Packaging Act of 1970. B. Pure Food and Drug Act of 1906. C. Durham-Humphrey Amendment of 1951. D. Kefauver-Harris Amendment of 1962. Answer: C. Durham-Humphrey Amendment of 1951. This question tests knowledge of key federal pharmacy laws and their specific provisions. The Durham-Humphrey Amendment of 1951 explicitly defined and separated drugs into 2 categories: those requiring a prescription from a licensed practitioner, prescription or Rx-only drugs, and those that could be safely purchased without one, over-the-counter or OTC drugs. This legislation was crucial for patient safety, as it clarified which medications needed professional oversight. For example, before this amendment, certain drugs might have been sold without a prescription, even if they posed significant risks. Remembering D for differentiate can help you recall that Durham-Humphrey differentiated prescription from OTC drugs. Question 4. A patient is prescribed warfarin for atrial fibrillation. Which of the following laboratory tests is most critical for monitoring the therapeutic effect of warfarin? A. Activated partial thromboplastin time, APTT. B. International Normalized Ratio, INR. C. Platelet count. D. Prothrombin time, PT, alone. Answer, B. International Normalized Ratio, INR. This question assesses knowledge of anticoagulant monitoring, specifically for warfarin. While warfarin does affect prothrombin time, PT, the International Normalized Ratio, INR, is the standardized measure used to monitor warfarin's therapeutic effect because it accounts for variations in reagents used across different laboratories, making results comparable. Maintaining an INR within a specific therapeutic range, typically 2.0 to 3.0 for most indications like atrial fibrillation, is essential to prevent both clotting and excessive bleeding. For example, an INR of 1.0 means normal clotting, while an INR of 4.0 indicates significantly prolonged clotting and a high risk of bleeding. Always remember that INR is the gold standard for warfarin monitoring due to its standardization. Question 5. Which medication class is typically considered first-line therapy for the management of uncomplicated hypertension in most patients without compelling indications for other agents? A. Beta blockers. B. Alpha-1 blockers. C. Thiazide diuretics. D. Loop diuretics. Answer, C. Thiazide diuretics. This question tests understanding of first-line pharmacotherapy for hypertension. Thiazide diuretics are generally recommended as initial therapy for most patients with uncomplicated hypertension because they are effective, well-tolerated, and inexpensive, and they have been shown to reduce cardiovascular morbidity and mortality. While other classes like beta blockers or ACE inhibitors are also used, thiazides are often the go-to for starting treatment. For example, hydrochlorothiazide is a commonly prescribed thiazide diuretic for this purpose. Remember that unless there are specific patient comorbidities, like heart failure or diabetes, that favor another class, thiazide diuretics are often the starting point. Question 6. A hospital pharmacy technician is preparing a sterile intravenous admixture. Which of the following is the most critical step to prevent contamination? A. Labeling the admixture correctly. B. Storing the finished product in the refrigerator. C. Performing proper hand hygiene and garbing. D. Verifying the expiration dates of all components. Answer, C. Performing proper hand hygiene and garbing. This question focuses on sterile compounding and preventing contamination. While all listed steps are important in the compounding process, performing proper hand hygiene, washing hands thoroughly, and garbing, donning appropriate personal protective equipment like gowns, gloves, and masks, are the most critical initial steps to minimize the introduction of microbial contaminants from personnel into the sterile environment. These actions directly reduce human-borne particles, which are a primary source of contamination. For instance, skipping hand washing before gloving dramatically increases the risk of transferring bacteria to the sterile product. Always prioritize proper hand hygiene and garbing as your first line of defense against contamination in sterile compounding. Question 7. What is the maximum number of refills allowed for a Schedule III controlled substance prescription? A. 0 refills. B. 1 refill. C. 5 refills within 6 months. D. 11 refills within 12 months. Answer, C. 5 refills within 6 months. This question tests knowledge of federal regulations concerning controlled substances, specifically refill limits for Schedule III drugs. Under federal law, Schedule III and IV controlled substances are permitted to have up to 5 refills within 6 months from the date the prescription was written. After this period or after 5 refills, whichever comes first, a new prescription is required. For example, if a prescription for hydrocodone/acetaminophen, a Schedule III drug, is written on January 1st, it can be refilled up to 5 times, but all refills must be dispensed by July 1st. It's essential to understand these limits for safe and legal dispensing of controlled medications. Question 8. A patient is experiencing muscle pain and weakness after starting a new statin medication. This adverse effect is known as myalgia. Which of the following lab tests would be most important to monitor in this patient? A. Liver function tests, LFTs. B. Thyroid stimulating hormone, TSH. C. Creatine kinase, CK. D. Basic metabolic panel, BMP. Answer, C. Creatine kinase, CK. This question assesses understanding of statin-induced adverse effects and appropriate monitoring. Statins are a class of drugs used to lower cholesterol, and one of their known dose-dependent side effects is muscle pain or myalgia, which can progress to rhabdomyolysis in severe cases. Creatine kinase, CK, is an enzyme found in muscle cells, and elevated levels indicate muscle damage, making it the most critical lab test to monitor in a patient experiencing statin-associated muscle symptoms. For example, if a patient reports severe muscle pain, a markedly elevated CK level would warrant discontinuing the statin and further evaluation. Always remember to check CK levels when a patient on a statin reports significant muscle symptoms. Question 9. Which of the following medications is a long-acting beta-2 agonist, LABA, used for maintenance treatment of asthma or COPD? A. Albuterol. B. Ipratropium. C. Salmeterol. D. Prednisone. Answer, C. Salmeterol. This question tests knowledge of common respiratory medications and their classifications. Salmeterol is classified as a long-acting beta-2 agonist, LABA, which means it provides bronchodilation over an extended period and is used for the maintenance treatment of asthma and chronic obstructive pulmonary disease, COPD. It is not used for acute symptom relief. Albuterol, in contrast, is a short-acting beta-2 agonist, SABA, used for rescue. For instance, a patient might use salmeterol daily with an inhaled corticosteroid, but keep albuterol handy for sudden breathlessness. Remember that LABAs like salmeterol are for long-term control, while SABAs like albuterol are for immediate relief. Question 10. A patient presents with symptoms of hypoglycemia, including sweating, tremor, and confusion. Which of the following is the most appropriate initial action? A. Administer a rapid-acting insulin dose. B. Encourage the patient to consume 15 to 20 grams of fast-acting carbohydrates. C. Advise the patient to lie down and rest. D. Call emergency services immediately without intervention. Answer, B. Encourage the patient to consume 15 to 20 grams of fast-acting carbohydrates. This question addresses the immediate management of hypoglycemia. For a conscious patient experiencing mild to moderate hypoglycemia, low blood sugar, the most appropriate initial action is to administer 15 to 20 grams of fast-acting carbohydrates, such as glucose tablets, fruit juice, or regular soda, to quickly raise blood glucose levels. This strategy is known as the Rule of 15. For example, a patient could drink half a can of regular soda or consume 4 glucose tablets. Always remember the Rule of 15 for conscious patients experiencing hypoglycemia: 15 grams of carbs, recheck in 15 minutes, repeat if needed. Question 11. A physician prescribes ciprofloxacin 500 mg orally every 12 hours for 7 days. The patient has a creatinine clearance, CRCL, of 25 milliliters per minute. According to renal dosing guidelines, how should the pharmacist advise the physician to adjust the dose? A. No adjustment needed. B. Decrease frequency to every 24 hours. C. Decrease dose to 250 milligrams every 12 hours. D. decrease dose to 250 milligrams every 24 hours. Answer, D. Decrease dose to 250 milligrams every 24 hours. This question tests knowledge of renal dose adjustments for medications. Ciprofloxacin is primarily eliminated renally, and a creatinine clearance of 25 milliliters per minute indicates moderate to severe renal impairment, necessitating a dose adjustment to prevent accumulation and toxicity. For ciprofloxacin, with a CRCL between 5 to 29 ml/min, the typical recommendation is to reduce the dose by half and administer it every 24 hours, meaning 250 milligrams every 24 hours. For example, continuing the standard dose for a patient with such impaired kidney function could lead to adverse effects like seizures or severe tendon issues. Always check renal dosing guidelines for renally cleared drugs in patients with impaired kidney function. Question 12. Which of the following medications is a proton pump inhibitor, PPI, commonly used to treat gastroesophageal reflux disease, GERD? A. Famotidine. B. Metoclopramide. C. Omeprazole. D. Ranitidine. Answer, C. Omeprazole. This question tests recognition of common medications used for GERD and their drug classes. Omeprazole is a well-known proton pump inhibitor, PPI, which works by irreversibly blocking the H+/K+ ADPase pump in gastric parietal cells, thereby reducing gastric acid secretion more effectively and for longer durations than H2 receptor antagonists. Famotidine and ranitidine are H2 receptor antagonists, while metoclopramide is a prokinetic agent. For instance, a patient with frequent heartburn might be prescribed omeprazole once daily to control their symptoms. Remember that PPIs like omeprazole are generally more potent and provide longer-lasting acid suppression than H2 blockers for GERD. Question 13. A pharmacy receives a prescription for oxycodone. The prescription is for 60 tablets, with dispense as written, DA, indicated. Which DEA schedule does oxycodone belong to? A. Schedule 1. B. Schedule 2. C. Schedule 3. D. Schedule 4. Answer, B. Schedule 2. This question tests knowledge of controlled substance scheduling. Oxycodone is a potent opioid analgesic that is classified as a Schedule II controlled substance by the Drug Enforcement Administration, DEA, due to its high potential for abuse and dependence, despite having accepted medical uses. Schedule II drugs have strict regulations regarding prescribing, dispensing, and refilling. For example, a prescription for oxycodone typically cannot be refilled and requires a new written prescription each time. Understanding the DEA schedule is critical for legal and safe handling of these medications in a pharmacy. Question 14. A patient undergoing chemotherapy develops severe nausea and vomiting. Which of the following antiemetic medications targets serotonin 5-HT3 receptors and is commonly used in this setting? A. Promethazine. B. Ondansetron. C. Dexamethasone. D. Metoclopramide. Answer, B. Ondansetron. This question assesses knowledge of antiemetic medications, specifically those used for chemotherapy-induced nausea and vomiting, CINV. Ondansetron is a serotonin 5-HT3 receptor antagonist, which is highly effective in preventing and treating CINV by blocking serotonin's action at these receptors in the gastrointestinal tract and the central nervous system's chemoreceptor trigger zone. While other agents like promethazine, a dopamine antagonist, or dexamethasone, a corticosteroid, can also be used, ondansetron is a cornerstone of CINV management. For instance, a patient might receive ondansetron intravenously before chemotherapy infusion. Remember that Setron drugs are often 5-HT3 antagonists, commonly used for nausea, especially in oncology. Question 15. A pharmacy technician is reconstituting a powdered antibiotic for oral suspension. The label states to add 75 milliliters of water to yield a concentration of 200 milligrams per 5 milliliters. If the powder itself occupies a volume of 25 milliliters, what is the final volume of the reconstituted suspension? A. 75 milliliters. B. 100 milliliters. C. 125 milliliters. D. 150 milliliters. Answer: B. 100 milliliters. This question involves understanding the concept of powder displacement in reconstitution. When reconstituting a powdered medication, the powder itself often occupies a certain volume, displacement volume. The final volume of the suspension is the volume of the diluent added plus the volume occupied by the powder. In this case, 75 milliliters of water is added, and the powder occupies 25 milliliters, so the final volume is 75 milliliters plus 25 milliliters equals 100 milliliters. This is crucial for accurate dosing and ensuring the patient receives the correct concentration. Always remember that the final volume of a reconstituted product is the sum of the diluent added and the powder's displacement volume. Question 16. What is the primary purpose of a black box warning, now called a boxed warning, on a prescription medication label? A. To indicate the drug is safe for all patients. B. To highlight a specific, significant adverse reaction or risk. C. To provide information about drug-drug interactions. D. To recommend off-label uses for the medication. Answer: B. To highlight a specific, significant adverse reaction or risk. This question tests knowledge of medication safety and regulatory warnings. A boxed warning, commonly known as a black box warning, is the strongest warning the FDA requires for prescription drugs, designed to call attention to serious or life-threatening risks associated with the medication. This warning helps ensure prescribers and patients are fully aware of potential severe adverse effects or contraindications. For example, certain antidepressants carry a boxed warning about an increased risk of suicidal thoughts and behaviors in children and young adults. Always pay close attention to boxed warnings as they indicate critical safety information that could impact patient well-being. Question 17. A patient with type 2 diabetes is prescribed metformin. Which of the following is a common gastrointestinal side effect that patients should be counseled on, especially when initiating therapy? A. Constipation. B. Diarrhea. C. Increased appetite. D. Weight gain. Answer: B. Diarrhea. This question assesses knowledge of common adverse effects and patient counseling points for metformin. Diarrhea, along with nausea and abdominal discomfort, is a very common gastrointestinal side effect of metformin, especially during the initial weeks of therapy. Patients are often advised to start with a low dose and titrate up slowly, and to take the medication with meals, to mitigate these symptoms. For example, a patient might start with 500 milligrams once daily with dinner for a week, then increase to twice daily. Counseling patients about this expected side effect helps improve adherence and manage expectations. Always advise patients starting metformin about potential GI upset and ways to minimize it. Question 18. According to USP less than 797 guidelines for sterile compounding, how often must a laminar airflow workbench, LAFW, be certified? A. Annually. B. Every 6 months. C. Every 3 months. D. Only upon initial installation. Answer: B. Every 6 months. This question tests knowledge of USP less than 797 standards for sterile compounding facilities and equipment. USP less than 797 mandates that all primary engineering controls, PECs, such as laminar airflow workbenches, LAFWs, and compounding aseptic isolators, CAIs, be certified at least every 6 months. This regular certification ensures the equipment maintains the necessary sterile air quality and functionality to prevent contamination of compounded sterile preparations. For example, if a LAFW was last certified in January, it must be recertified by July of the same year. Adhering to this schedule is crucial for maintaining a safe sterile compounding environment. Question 19. Which of the following medications is a common angiotensin-converting enzyme, ACE, inhibitor? A. Valsartan. B. Amlodipine. C. Lisinopril. D. Metoprolol. Answer: C. Lisinopril. This question tests recognition of common cardiovascular medications and their drug classes. Lisinopril is an angiotensin-converting enzyme, ACE, inhibitor, a class of drugs primarily used to treat hypertension, heart failure, and protect the kidneys in patients with diabetes. ACE inhibitors work by blocking the conversion of angiotensin I to angiotensin II, leading to vasodilation and reduced blood pressure. Valsartan is an ARB, amlodipine is a calcium channel blocker, and metoprolol is a beta blocker. For example, a patient with high blood pressure might be prescribed lisinopril to help manage their condition. Remember that many ACE inhibitors end with the suffix pril. Question 20. A patient reports that their urine has turned reddish-orange since starting a new medication for a urinary tract infection, UTI. Which of the following medications is most likely responsible for this discoloration? A. Ciprofloxacin. B. Nitrofurantoin. C. Phenazopyridine. D. Trimethoprim/sulfamethoxazole. Answer: C. Phenazopyridine. This question assesses knowledge of specific drug side effects, particularly common and noticeable ones. Phenazopyridine is a urinary analgesic prescribed to relieve pain, burning, and urgency associated with UTIs. A very common and expected side effect of phenazopyridine is that it causes urine to turn a reddish-orange or even brownish color, which can also stain contact lenses or clothing. This is a harmless but important counseling point for patients. For example, a patient might be alarmed by the color change if not properly informed. Always counsel patients about this distinct side effect when dispensing phenazopyridine to prevent unnecessary alarm. Question 21. A pharmacy dispenses a medication that contains a mislabeled concentration. This error is caught after the patient has already taken one dose. What type of medication error is this categorized as, according to the National Coordinating Council for Medication Error Reporting and Prevention, NCCMERP? A. Category A. B. Category B. C. Category C. D. Category D. Answer: D. Category D. This question tests knowledge of medication error classification. According to the NCCMERP taxonomy, a Category D error is defined as an error that occurred and reached the patient, but did not cause harm. In this scenario, the mislabeled concentration reached the patient, and they took one dose, but the question implies no harm occurred, fitting the Category D description. Category A is a potential error, B is an error that occurred but did not reach the patient, and C is an error that reached the patient but was not administered. It's vital to classify errors accurately to understand their impact and implement effective prevention strategies. Question 22. A patient asks about the appropriate storage for insulin vials. Which of the following is the correct storage instruction for unopened insulin vials? A. Store at room temperature until expiration. B. Store in the freezer until needed. C. Store in the refrigerator, 2 to 8 degrees Celsius or 36 to 46 degrees Fahrenheit, until expiration. D. Store in direct sunlight for optimal potency. Answer: C. Store in the refrigerator, 2 to 8 degrees Celsius or 36 to 46 degrees Fahrenheit, until expiration. This question tests knowledge of proper medication storage, specifically for unopened insulin. Unopened insulin vials, pens, or cartridges should always be stored in the refrigerator, at temperatures between 2 to 8 degrees Celsius or 36 to 46 degrees Fahrenheit, to maintain their potency and extend their shelf life until the manufacturer's expiration date. Once opened, most insulin products can be kept at room temperature for a specified period, typically 28 days, but unopened vials require refrigeration. For example, placing unopened insulin in the freezer would damage it, while storing it at room temperature would significantly shorten its effective life. Proper refrigeration is key to ensuring unopened insulin remains potent and safe to use. Question 23. Which of the following conditions is a contraindication for the use of ibuprofen? A. Mild headache. B. Osteoarthritis. C. Active peptic ulcer disease. D. Fever in children. Answer: C. Active peptic ulcer disease. This question tests knowledge of contraindications for common over-the-counter and prescription medications, specifically NSAIDs like ibuprofen. Ibuprofen, a nonsteroidal anti-inflammatory drug, NSAID, can irritate the gastrointestinal lining and inhibit protective prostaglandins, increasing the risk of gastrointestinal bleeding and ulceration. Therefore, active peptic ulcer disease is a significant contraindication for its use, as it could exacerbate the condition. For example, prescribing ibuprofen to a patient with an active ulcer could lead to severe internal bleeding. Always screen for a history of GI ulcers or bleeding before recommending or dispensing NSAIDs. Question 24. A patient is prescribed vancomycin for. Which of the following adverse effects is associated with rapid intravenous infusion of vancomycin and can be mitigated by slowing the infusion rate? A. Nephrotoxicity. B. Ototoxicity. C. Red man syndrome. D. Thrombocytopenia. Answer: C. Red man syndrome. This question assesses understanding of specific drug-related adverse effects and how to manage them. Red man syndrome, characterized by flushing, erythema, and pruritus, itching, primarily on the face, neck, and upper torso, is a non-allergic histamine release reaction associated with the rapid intravenous infusion of vancomycin. It is not a true allergic reaction but can be uncomfortable and alarming for the patient. Slowing the infusion rate, typically over at least 60 to 90 minutes, and administering antihistamines beforehand are common strategies to prevent or manage this syndrome. For example, if a patient starts showing signs of redness, pausing or slowing the infusion is the immediate action. Always remember to infuse vancomycin slowly to prevent red man syndrome. Question 25. What is the appropriate needle gauge for administering an intramuscular, IM, injection in an adult? A. 27 gauge. B. 25 gauge. C. 22 gauge. D. 18 gauge. Answer: C. 22 gauge. This question tests practical knowledge regarding medication administration techniques. For intramuscular, IM, injections in adults, a needle gauge typically ranging from 22 to 25 gauge is appropriate. A 22 gauge needle provides sufficient rigidity for penetration while minimizing patient discomfort and allowing for injection of various medication viscosities. Other gauges like 27 gauge are too small for IM, while 18 gauge is generally too large and used for drawing up viscous medications or specific procedures. For example, when administering a flu shot into the deltoid muscle of an adult, a 22 or 23 gauge needle is commonly used. Remember that needle gauge selection balances patient comfort with appropriate delivery of the medication into the muscle.